Hi, everyone. My name is Dr. Scott McNabb. I'm a research professor at the Emory University Rollins School of Public Health. It's a real pleasure to be here. I want to thank Dr. Patrick for inviting me to reflect on the establishment of the Liberia Frontline FETP program in 2014. I certainly remember 2013 and 2014 very well. We were fortunate to win a large cooperative agreement from the U.S. Centers for Disease Control and Prevention to establish the Frontline FETP program. And thinking about this as the PI of this cooperative agreement, my commitment was to build capacity in Africa, not a castle at Emory. So I devoted 75% of the resources to go to our partner, the Africa Field Epi Network, headquartered in Kampala. So with that commitment, we were successful to win this cooperative agreement. And I remember working with one of my mentors, Dr. Richard Dicker, who's a fantastic teacher, trainer, to think through the competencies, the learning objectives, and the content for the Frontline FETP program. One of the first ones that was really established using this new concept. And Dr. Gada Farhat, who also was working with us at Emory. So I remember those really wonderful days of thinking how best we could support Liberia during the Ebola crisis. And in May and June of 2014, we hosted a stakeholder meeting in Monrovia, which brought together all of the key principles to think about workforce development. And out of that came an important document. Then we realized that Dr. Tom Friedman, who is the US CDC director, was visiting Liberia the 1st of August. And so we arranged for the very first cohort to begin that day, the first cohort of frontline FETP trainees. And I remember Tom arriving with the US ambassador to Liberia and attending the class, first class, and also actually giving some comments. He was commenting on how he had achieved his master's in public health from Columbia University. But when he went to some of his faculty colleagues, professors, and asked them about how do you do an outbreak investigation, they really had never done an outbreak investigation. And I think the point that Tom was making is that the FETP program is the boots on the ground training activity which helps professionals develop the skills and competency to be able to do active public health practice. You know, I'm trained through the Epidemic Intelligence Service, the IS program at the US CDC, and the FETP program was established by Dr. Phil Brockman, who also was a colleague at Emory and worked with us at the beginning of this project too, before his untimely death. So it was a real honor to work with Dr. Brockman too. So we, in this establishment of the first cohort in August 1st of 2014, I remember walking into the new Emergency Operations Center, actually before it was even opened, and looking at the organizational structure of the EOC and how it was going to be operated and so forth. And I remember there to be two training rooms on the second floor, separated actually, and I was making the case to the EOC operations manager that we should combine those two training rooms. We could make really one training room out of the two. I'm not sure if that was ever done, but it was certainly something would have made training a little bit easier. Of course, at that time, we were doing face-to-face training, and we would be in the training room while the faculty were offering the lectures. But before that, you know, we were in Liberia, and I was interviewing, you know, our colleagues at the African Field Epi Network are really excellent epidemiologists, having worked in the field, and we were considering who would be the best resident advisor for this new program in Liberia. And I remember interviewing Dr. Mame, she impressed me so much. The first question she asked me was, how would you define leadership? And I could not have been asked a better question. It was the perfect question to ask. So she was obviously the right person for the job and has done really a remarkable job there too. So we're very honored to work with Dr. Mame and Dr. Peter and others, Dr. Joseph, others who've been a part of the training program over the course of its time period. And it's grown, became one of the most successful training programs that exist, actually. It's really quite remarkable, very honored and proud of it. I was going to also point out something else here real quickly to you all.